Okay, guys. So obviously today we start our introduction to talking about the research process, right? And to talking really about what research is. Okay, and so ultimately, right, when we think about what research is, we typically think, right, about something like this. Typically, research that's done in a lab, in an environment that's very very controlled, right, and potentially, we don't really have a very good, um, we don't necessarily have the best maybe conception of what research is, and I think that sometimes we kind of conceptualize that um, as being maybe a little bit dry and a little bit boring, but it doesn't necessarily have to be that way, right? As we'll talk about kind of throughout the remainder of the class, right? There are various types of research that that we're going to talk about throughout the semester that we can employ, right, to study problems and to study issues. So we will spend a fair bit of time talking about experimental research, right? Uh, and so that's how we're going to kind of start, right? But we'll also talk about obviously observational research and then research done in clinical settings as well. Okay, so here's the deal, right? Why like how in the world is research used, right, and what, how do various, not only individuals but entities and organizations utilize research, right? So we're going to spend a lot of our time, right, connecting or the content in this class, right, research methodology, internal external validity, so on and so forth, right, to obviously medicine and allied health, right? But it's really important to know that there are obviously other ways that research is utilized, right? So I want to kind of start by asking you guys a question. All right. You've actually heard people use the term research a lot, and it's become ubiquitous, right? What do you think, right? How are how are some ways that the term research is used, just kind of in our society, and how is that potentially maybe a little bit incorrect or errant? And in what ways do you think that people tend to misunderstand the concept and process of research? What do you think?
I think that people will sometimes say, like, if they don't know something, they're like, "Oh, I'm gonna go research that," and they just, like,
Okay.
search the internet, and
Yep.
that's kind of more
Absolutely.
casual.
Yep. Emily, fantastic answer. Yes, I like that a lot. Right. So yeah, people will actually utilize, sources like Google things, and Google in itself is not bad, right? Just depends on how you use it. So Emily, you brought up the internet, right? What Just to kind of expand on that response, what are some potential problems with just pulling up any random information or article just from the internet? What are some potential issues and concerns that you or anyone might be able to think about with just a simple Google search? Why could that be problematic? Lakeisha, you can go ahead. Yeah.
Some of the information that you just like find on Google might be false information and it
Yep.
could be like advertising something that's completely like incorrect.
Absolutely. Absolutely. And so, there are, Lakeisha, thank you for that response. There are, right, particularly, as you guys progress in your careers, you're going to find that there will be reps and different, even sales reps, right, from different companies. Maybe if you work at an office, that will come and whether it's a pharmaceutical rep or a rep for some sort of durable medical device, they will often come into your place of work and they will actually often cite research studies backing their product, right? But very often, um, so very often, guys, what happens is that they will actually conduct research in their own settings, right? That's actually not independently reviewed, and very often that can uh, lead to a bit of bias, obviously, in the way that they present their information. Okay, so kind of moving forward a little bit. Um, so it says, let me just check. I'm gonna. Okay, so Brevin is here. I just got an email from him. I just want to make sure that he's with us. Very good. Okay, awesome. So let's say that you guys are considering maybe making, okay, a new purchase. So let's say that you're thinking about, let's say that you're 2 years out of school, right? You're making some money, but you've got to pay off some debt and you have to do other things, right? And so there's a car that you really want, but you know that that's really not going to be a possibility for you, at least right now. And so you need a vehicle, right? But you need something that's potentially maybe middle of the road as far as cost, but reliable. Okay. How do you think consumers utilize research, and how do you think somebody that's looking to consume research or use information would go about researching something prior to making a purchase?
They would probably look at reviews of other people who have bought the car.
Absolutely. Yeah. So they would look at reviews, right? Maybe pull up information on like consumer reports, those types of things, right? Okay. Awesome. Great job, guys. So here's the deal, right? Also, like as you guys will see moving forward, we saw this a lot with COVID, and we see this a lot, particularly in the world of epidemiology as well, right? Governments will often, government officials, government organizations will often use research, right, and fund research projects that target specific demographics and or will, different target audiences, particularly um, in the kind of the lens of epidemiology, right? We saw that a lot, not only with COVID, but we've seen that with other major public health problems like concussion, lung cancer, cancer in general, right? And even public health campaigns like smoking cessation, so on and so forth, right? What what is one way, and you guys may not remember this. Um, you might be too young to maybe your parents never did this, or maybe they collected it a different way. Do you remember your parents ever getting a phone call from somebody with the U.S. government and them actually taking census data right over the phone? And your mom, dad, whoever was on the phone for 15, 20 minutes, right? Answering questions about how many people live in your house, so on and so forth. Okay. That's another way that governments collect demographic data, and they utilize that and they collect frequencies and averages, right? Within that data to describe populations, right? So here's the deal, right? And kind of just an additional point here about research. All of you, okay, all of you, as future healthcare providers, are going to have to utilize research in various ways, right? So that is very much a necessary skill. Um, whether it's you've been asked to put together a project, right? Or maybe you are the nurse lead within a specific department, right? And you're talking with the physicians that you work with about maybe a specific clinical problem. We'll talk a little bit more later on this semester about quality improvement, right? And how quality improvement actually plays in uh, to correcting larger problems and or kind of fixing larger problems at the level of patient care by implementing changes in systems. Okay, so the bottom line is that this is a necessary skill that all of us have to have. Okay, okay, so guys, and I know these slides are a little simple, but we're just kind of doing a very basic introduction today. So here's the deal. Oftentimes, okay, we'll utilize research for the sake of consumption, right? Sometimes maybe it's a patient that asks you a question, in the clinic that maybe you don't necessarily know the answer to. Right. I've been a clinician for a long time, and there's interesting questions that I still don't have. So, somebody will ask me a question and maybe I don't have the answer right away. Right. But what I have to do, obviously, then is, become a consumer and a user of research, right, to be able to uh, obviously find the answer to that question. Um, now, let's say that, obviously, what type of kind of people and or personnel within healthcare, how do you think people within healthcare consume research? How do you think they do that? How do you think, like, for what reasons is research consumed and used uh, in healthcare? Chloe, yeah, go ahead.
Maybe a physician is seeing a patient who has having these symptoms and the physician has never seen these group of symptoms before, so they're doing research on how to diagnose it.
Okay, beautiful. Yeah, I like that a lot. Okay, yeah. Oh, so okay, yeah, fantastic response. The whole raise hand thing, I'm kind of mind blown right now because none of my classes ever have done the whole raise hand thing, and I like it. I don't know. It's kind of nice. Okay, guys. So obviously, production of research. Okay. Now, to Chloe's point. Okay, Chloe just said that maybe a doctor might utilize research, consume it, and use it to maybe help understand the pathology, right? That they've never seen before, maybe a group of symptoms that they've never seen before. Okay, but okay, Chloe just brought up a really good point. What if the information that that doctor finds or that physician finds or even that nurse practitioner finds, okay, on that condition is insufficient? What if it doesn't answer the question? Okay, what if it puts the provider, right, in a position of needing more information, right? How how does someone, right, who might be a producer of research, so a producer of research is generally a researcher, okay, and or somebody conducting research, okay, how would they utilize that information that's previously known, pardon me, to help produce future research? What do you think? Emily?
Maybe they would consult a variety of resources from other researchers and gather that data.
Okay, yeah. And so, Emily, I'm going to follow up on your question because I like what you said, right? So, what do you think if they collect all that research and they follow up and they read all those papers, right? Do you think that that might lead them to a new question that needs to be answered? Do you think they might utilize that information to formulate a new research question potentially that's relevant to their practice or their patient?
I think so, yeah.
Yeah, absolutely right. Okay, so nice job. So obviously, guys, here's the deal, right? As consumers, right, whether it's a physician, whether it's a provider, or as a producer, like if you're a researcher, right, even a clinical researcher, right, we are constantly either consuming research and utilizing it to improve patient care, or we are producing new research, right, to either contribute to the body of knowledge and or, right, also um, improve patient care in a lot of cases. Okay, here's the deal, right? This is like, if this is like the only thing that you remember from this class this semester, right? Ultimately, this is the entire goal of this class, right? It's to take the research that's done in laboratory settings. So when we talk about, right, uh, research done in a lab or in a very controlled setting, right? That's essentially basic science or lab science. Okay. And the term that we utilize for that oftentimes is bench research. Okay, it's bench research. So for many of you, right, as providers, it's going to be your job to read a research study, read a paper, right, and translate that information to the bedside, to the patient, right? And so we spent the first couple minutes of class today talking about what research is. Okay. And people utilize it in a lot of different ways. But the bottom line, guys, is that research is a way to gather information, right? And make sound decisions or judgments or to develop new knowledge. Okay. Um, now, that's seems like a really kind of obviously common sense, right, definition, and probably makes a lot of intuitive sense to people. Um, but we're going to spend time this semester unpacking this idea, right? Because there are many layers to this definition, okay, that involve obviously previously known information, okay, purpose, the purpose of research studies and problems that arise because of previously conducted research, and also, the validity and the strength of the methodology inside of a lot of studies. Okay. Um, and as we progress, we'll even talk about different research designs, like qualitative methods, like methods or measures of clinical association, right? So, and just a show of hands, right? If I bring up the terms specificity and sensitivity, has anybody heard those terms before? Okay, so those are terms, guys, that relate to diagnostic accuracy, right? So everything that we do, particularly within a healthcare setting, whether it's whether you're a nurse, whether you're an athletic trainer, whether you're a physical therapist or an OT, whatever you are, right? Um, the basic skills that we learn, right, um, within the first few weeks of class, particularly when it comes to experimental studies, are going to be replicated and applied in different ways to answer different types of questions. Okay, but as we talked about, the number one goal, okay, of this class is to take everything that we're going to learn throughout the course of the semester and move that information, okay, from a research setting to the bedside of the patient to be able to make the best decision. Now, kind of and I know I ask a lot of questions like this, but particularly when we spend time talking about quality improvement, okay, toward the end of the semester, do you guys know how long it takes for the results of a well done research study that has an impact on clinical practice? Do you know how long it takes for providers to generally adopt new research or guidelines into clinical practice? I don't know if you guys have heard this yet, but it takes an average of 17 years, 17 years, okay, for a provider to be able to implement the findings of a study into their own practice. That's crazy, right? That's a very, very long time, particularly if patients are potentially dependent on that information. Okay. So when we talk about research, guys, okay, we are mainly concerned, okay, about the scientific method. Okay, and we're going to spend a lot of time within these first couple weeks, right? We're going to spend a lot of time working together to formulate a solid research question. Okay, we're going to spend time talking about how to actually ask a research question, right? And we're going to learn some things because so we talked about Wednesday, right? Utilizing the acronym PICO, right? Who remembers? Does anybody remember what PICO stands for? What does PICO stand for? Anybody have that written down potentially? Emily, yeah.
I think it's population, intervention, comparison, uh, and then outcome.
Yeah, crushed it. Fantastic. Yep. Okay. Yeah, absolutely. Right. So utilizing those components, right, that we wrote down on the board on Wednesday, and we'll talk about those more as we move forward, right? We're going to utilize that format to help us formulate appropriate research questions. So, utilizing the scientific method, after we have formulated a research question, the next step, okay, is to do background research. All right. And the way that we're going to learn that this semester, right, involves finding appropriate studies that are relevant to your question. Okay, that are relevant to your question, that not only right provide previous knowledge about what's been done maybe within the area of your question, but that also potentially leave room for some questions, right? And that also identifies a gap in knowledge. Okay, so from that information, from first formulating the appropriate question, doing research by looking at previous studies, right, that are relevant to your question, that's going to allow you to formulate a hypothesis, right? And then from there, obviously, when we get really, we're going to be focused on these first three steps, okay, throughout the semester as we work through our proposal together. And then generally, if we were to actually finish our study, we would be obviously collecting data, testing the hypothesis through data analysis, and then determining our conclusion, right? So we're gonna spend a ton of time working on steps 1 through 3, right? So we're not necessarily going to spend a ton of time on 4, 5, and 6, but we will discuss those things, okay? Uh, in some manner of detail. Okay, so this is the scientific method, right? So obviously we are, obviously first we're, working towards kind of dealing with facts, right? And then from the facts that we essentially acquire from our lit review, formulating a theory, right? And then creating a principle. So w- ultimately, okay, and this is, and we will talk about this more as we move forward. But let's say that I'm conducting a study, okay, and my study, once I finish it, is then reproduced, right? Let's say that it's reproduced 10 times by other researchers using the exact same methods, okay? Um, and the findings are similar, right? Similar and or the same. If they can take a study and reproduce that study that many times and get the same results, do you think that I can trust that study? Okay, that I can essentially take all of those studies that have been done and allow that information to potentially change the way that I treat a patient? Who thinks yes or no? And if you need me to rephrase the question, let me know because sometimes um, I phrase things a little bit weirdly. So if you need me to just say that again or rephrase it, just holler at me. Okay. So basically, guys, right? Kind of one of the rules that we'll learn, right, is the more often that a study is replicated with similar findings, okay, the more that I can essentially trust that information and utilize that information and rely on that information to be essentially impactful, right? And not only impactful, but consistent and something that I can utilize in my practice with a high level of certainty, right? Because it's been replicated many, many times. Okay. So we, and guys, this is pretty key, right? So after we formulate, right, the appropriate research question, okay, using the PICO method, then we identify our variables. Okay, so if we think back to what we talked about on Wednesday, okay, using that the PICO format, okay, so we said we were talking about knee replacement, and we used the example of ibuprofen versus Tylenol, right? So we said our population was those undergoing knee replacement from, we said the ages of 50 to 70, I believe, and then we said, we wanted to compare ibuprofen to Tylenol. Um, and how that impacted the resolution of pain, okay, post-op. So when I use the term variable, okay, when we use that example, the medications being the ibuprofen and the Tylenol, those were variables. Okay, those are things that were measured and or manipulated in my study, right? And the other thing, right, is the outcome of that, which was pain scores in that population. Okay, that was also a variable because it's something that I'm testing. All right. So obviously, okay, as we test those variables, it's going to be really important to us to make sure that the methodology within our study, okay, is firm and not only firm, but strong and free from bias, right? And factors that could potentially um, impact the outcome of our study, right? But then also, it's really important to make sure that the study that we conduct is applicable to the population as a whole. Okay, so it's really, really difficult sometimes with a lot of studies, particularly in the world of athletic training, rehabilitation science, and other disciplines, um, where they're looking at, and for example, and this might seem a little, for those of you that like animals, okay, we do a lot of research on concussion. In my field, we spend a lot of time learning about it, studying it, right? So traumatic brain injury. And there was a study conducted, right, where they looked at essentially the metabolic cascade, neurometabolic cascade after traumatic brain injury in mice. Okay, um, and they identified these neurometabolic changes in the brains of mice. Okay, after a blow to the head. okay, using some sort of object in a lab. Okay, the mice were okay, none of them died, right? But that's just how they studied this problem. That's how they studied this theory. Okay, now to what level? Okay, to what level does that type of a study extend to the to the broader population as a whole? Does it or does it not? What do you think? So if we study mice, right? If we study mice and we study, you know, neurometabolic responses in mice after head trauma, right? How do you think that can be applied to humans? Well or not very well? Olivia, yeah.
It's probably not like an exact comparison, but it's a good stepping off point to do more research and kind of take what you've learned from the mice to know where to start with human research.
Okay, yeah, definitely. That's a fair point. I'll take that. That's great. So, Olivia, I'm going to ask you a follow-up question. Sorry, I'm not picking on people, but when you provide me with a good response like that, I want to kind of try to take things a step further. Okay, so Olivia, definitely a good point. So let's say that you maybe we have that study on mice, right? Um, what purpose do you think that information would serve you, or what purpose would that information serve in creating potentially a research question if you were interested in the same area, right? What purpose would that information potentially like provide?
It would probably like help narrow down a research question based on what you already know.
Perfect. Okay. Yeah. Excellent. Okay. And so then let's say, Olivia, just based on that we have information, right? We've written a great introduction and lit review on this problem, and we utilize that study, right? Uh, Utilizing the mice as one of the papers that we cite, right? As a way to kind of introduce and undergird the principle that we're studying, right? Now, definitely there are some issues though, right, with reproducibility of that study, because from an ethical perspective, we can't induce a blow to the head in human beings and then study the neurometabolic cascade, right? That would be unethical, right? So I can't put a human participant in harm's way to study that problem. Okay, so there might be some issues with reproducibility, but okay, to Olivia's point, that may also give us information that we need to potentially study this issue in a different way. Okay, and one area that we've seen a lot of, and although it's still kind of a very difficult area, is actually the utilization of biomarkers. Okay, blood biomarkers in studying concussion and traumatic brain injury. Okay, so variables, guys. And this is one of my favorite movies. If you don't know this movie, you can watch it if you want. It's pretty funny. Variables. Okay, variables are the building blocks of our research question. Okay, so as we talked about utilizing our PICO example, okay, a variable was something that we were essentially testing, right? So that's going to be the independent variable that we're manipulating. We'll talk more about that later, right? That's not anything that I expect you to know right now, right? And then we have the dependent variable, which is the outcome that the test outcome that we were essentially looking at, right? So obviously, that variable can help kind of differentiate, one group of subjects from another, if you have different levels of a certain variable, right? And sometimes variables can have more than one value. But as we're going to learn variables, right, we're going to talk about, um, you know, kind of how these variables are related, and really pretty strictly, how an independent variable is essentially manipulated in a study, and how that can impact potentially both positively and negatively the outcome of interest, which is our dependent variable. Okay. Now, here's the thing. We just spent time talking about um, how sometimes, while it's true that while it's true that laboratory studies can provide us with valuable information, right? Valuable theoretical information to help formulate research questions and problems, right? There can be some potential drawbacks though too, to those as well. So a general principle that we're gonna discuss, okay, throughout the semester in more detail, is this relationship between internal and external validity. Okay, so obviously, studies that are performed in traditional research environments, laboratories, okay, these types of settings generally have high levels of internal validity. Okay, because right, those environments are very, very tightly controlled without the impact of extraneous factors. Okay, individuals working in those laboratory environments generally are experienced researchers who have taken the time to eliminate and curtail the effects of confounding factors in those external forces. Right, so they can be very sure that the variable that they're testing will have as much of an impact as possible on the test outcome, right? Which is going to be our dependent variable, right? And so, but the issue, okay, like we talked about a little bit, is that internal validity, okay, very often has limitations on its ability to be applied to the population as a whole, because the vast majority of us have problems, right? Uh, that occur generally outside of a lab environment, right? For example, the patient with diabetes or the patient with heart disease doesn't live their life in a lab. Okay, the patient with uh, you know osteoarthritis, okay, so on and so forth, okay, does not live their life in a lab. They live their life obviously uh, in the outside environment, okay, in the outside world, where there are various extraneous factors that we have to be aware of. So, one of the hardest things to do when conducting any type of study, and this is particularly true with our experimental studies, which is the first uh, type of study that we're going to talk about when we get into the second part, the second kind of area of the class, right, is finding this balance between internal and external validity, right, ensuring that our methods um, are as kind of pure as they can be, right, and as well conducted as they can be, without having a large impact, uh, on the outcome that can be explained by extraneous variables other than what we were testing. Okay, but generally speaking, the more internal validity that we have, the less applicable that those studies often are to the environment as a whole. So there's generally an inverse relationship, okay, between internal and external validity, right? And so, guys, when I use the term validity, okay, and this is the last slide, but what do you think I mean when I say if something is valid? Like it's kind of become a bit of a pop term. Like we use that a lot just in everyday speech. But when I say that an instrument is valid or that something is valid, right? What do you think I mean? Don't be afraid to throw anything out there, guys. It's not. Give it your best shot. Emily. Yeah.
That it's objective information and can be backed up by credible sources.
Okay. Yeah. Yeah. That's a good thought. So ultimately, as we'll talk about later on, right? Does the question, does what we're measuring or studying, does it truly measure what it's supposed to measure, right? And we'll have a really good example of that later on throughout the semester. Um, how many of you guys are familiar with continuous glucose monitors? I'm sure you guys know about those to some degree, and maybe have talked about those in class. Um, so a really, really good example, and we'll actually utilize this as an example in class. Um, are the values, okay, that a patient gets from a continuous glucose monitor versus true serologic testing, right? Blood tests for things like not only random glucose, but hemoglobin A1C, right, as well. And we'll talk about potentially some concerns with reliability and validity. So those are terms that we're going to continue to unpack throughout the semester. So um, great job today, guys. So this is a really kind of a simple introduction, and we're going to continue to dig deeper. So a plan for Monday is we'll get together. We're going to talk a little bit more about the scientific method in a little bit more depth, right? And why that actually is the foundation for research. And we'll talk a little bit about too how there are other forms of uh, data, right, and or information that we can simply gain through observation in clinical practice. But yeah, you guys, that's it for today. Um, So as we wrap up, are there any questions that I can answer for you guys before we call it an afternoon? Okay. Well, guys, have a wonderful, safe weekend. Okay, whatever you do, be safe and enjoy some time this weekend. But Monday we'll keep on trucking. Okay, I'll see you guys in Matson, and have a great weekend. And I'll see you guys Monday. Okay, take care.
Thank you.
Thank
Thanks,
you.
guys. Take it
Thank
easy.
you.
Yep. Bye.